When Trump says an MRI is part of a standard physical, he's lying. They went in there to look for something specific. Doctors don't throw MRIs in for funsies. Now, why would he pretend that it's standard? And why would a doctor say it's the best MRI he's ever seen? Because MRIs are either normal or abnormal. You wouldn't have to spin it like this if it were just routine.
Because it's part of my physical. Getting an MRI is very standard. Well, you think I shouldn't have it? Other people get it.
Typically an MRI
I had an
is
MRI.
a specific part of your body.
Here's what the story is. I had an MRI. The doctor said it was the best result he has ever seen as a doctor. That's it. But I had an MRI as part of my standard yearly, or I think they do it every 2 years, but I have the physical every year. And the result was outstanding.
Was it your brain or
No,
your heart?
I have no idea what they analyzed. But whatever they analyzed it well. And they said that I had as good a result as they've ever seen.
There is no way a doctor is going to perform an MRI and not tell you which part of the body or which organ they're looking at. If you've had an MRI, you know the doctor explains why the MRI is needed. The order specifies the specific body part, and then the MRI tech, she confirms it with you. We know you're hiding something when you try to make an MRI sound normal. So you heard him. When we all go in for our annual physical, we should expect an MRI.
Here we go again with Donald Trump putting his finger in the face of another reporter. This is what happens when you try to brag about getting an MRI and all of a sudden it backfires. Brace yourselves, ladies and gentlemen.
They asked about my MRI. MRIs are very...
Governor Walz asked you to release the MRI, right?
Will you tell us what it was
Governor
for?
Walz, you mean the incompetent governor? So if they want to release it, it's okay with me to release it. It's perfect.
What was the reason they
It's like my phone call where I got impeached. It's absolutely perfect. So if you want to hear about it or if you want to release it, do you want to have it released?
Yes,
News Nation, failing News Nation. News Nation is doing lousy, by the way. But if you want to have it released, I'll release it.
Please, can you tell us what they were looking at?
For what, release it?
No. What part of your body was the MRI looking
I
at?
have no idea. It was just an MRI. What part of the body? It wasn't the brain because I took a cognitive test and I aced it. I got a perfect mark, which you would be incapable of doing. Goodbye, everybody. You too.
Thank you, Mr. President.
Thank you, sir.
Ain't no way I could do it, ladies and gentlemen. There's no way I could keep allowing him to get away with putting his finger in my face and just slamming doors in front of me like this simply because we're asking him about his health. You know, when people ask you about your health, it comes from a place of concern. And for him to just do this and feel like it's part of the status quo, it's how he gets down, it's how he operates. Oh my gosh. And for any of you men out there that think this is acceptable, I say to you, if this happened to your wife, what would you do? If this happened to one of your loved ones, what would you do? This is not the behavior that we want to see coming from the President of the United States. Melania, hello, speak up, say something. This screams, as far as I'm concerned, if you want me to be honest, this screams Jeffrey Epstein.
Hey guys, welcome back to the channel. Now I want to give credit to the original creators of the clips in this video. Of course, thank you guys for always supporting the channel. If you're new here, don't forget to hit that like button. Don't forget to subscribe and join the conversation in the comments because I really want to hear what you have to say about this.
Most of you by now have heard that Trump had an MRI done last month in October. 6 months prior, he had a physical. And here recently, Governor Tim Walz out of Minnesota came out on his social media and said, release the MRI results. And I'm like him, yeah, release them. If there's no issues, release them. But yesterday, on Sunday, Trump was asked about those MRI results and what he had the MRI done on. He said he didn't know. And by the way, this question was asked by a female journalist from CBS. He said he didn't know, but he certainly knew that it was not on the brain because he had a cognitive test where he received a perfect score, or as he called it, a perfect mark. Which then he turned around and told that female journalist she would be incapable of passing a cognitive test. At what point will these female journalists just stop asking him questions? Because if they're not going to just match his same energy and give it back to him, then why keep asking him questions? No one is speaking up for those female journalists. They just let it slide. Because at this point, the insults are just becoming the norm. He's going to continue to do it if they don't speak up.
Media, you need to stop. You need to stop. And you needed to stop a long time ago. It is time for you guys to take the reign of actual journalism back versus entertainment. Now, you guys go and ask Trump a question like, oh, you got an MRI. And you let him respond with, I don't know what body part I got it on. Now, we all know if you have some kind of CAT scan, MRI, or X-ray, you know if somebody was taking a picture of your foot versus a picture of your head. But you let those answers go. Where are you guys actually going in and doing journalistic reporting, investigations to let people know what is wrong with this man and whether or not he is physically fit to do this job? Because I know and you know, and we're not medical doctors, it is not normal to get an MRI weekly or bi-weekly. It is just not normal. Can we stop normalizing this, I don't know, and ask the question that needs to be asked? What is wrong with him? You guys had no problem speculating and going to this person or that person about Biden, but you won't do it about Trump. Do your job. Do better. Stop treating the news as entertainment in regards to the president.
So once again, Donald Trump just thinks we're all idiots. Because he recently went to Walter Reed in October for a second routine annual physical, and he received MRIs and advanced imaging, to which the press said they would like to see the results of that, and he said, oh sure, no problem. But he says he doesn't know what body part was scanned. What? When you lie down to get an MRI that takes a good half an hour of scanning, you are told what they're scanning. You don't lie down in that big machine for a half an hour and not know what the fuck they're scanning. You will know if they're scanning your head, or your chest, or your leg. This is like the dumbest fucking answer he could have given. He said, oh, they didn't scan my brain because I took a cognitive test and I aced it. You don't ace a cognitive test, you moron. It's not the ACT. It's to test whether or not your brain is melting. And if you're saying you don't know what body part was scanned, your brain's fucking melted. But here's the part that people keep forgetting, and I have to mention it all the time. Regular physical exams, even for U.S. presidents, generally include things like vital sign checks like your blood pressure, your heart rate, some cardiovascular checks, maybe a chest x-ray, and basic things for your ear, nose, and throat. According to medical guidance literature for asymptomatic adults, comprehensive diagnostic imaging, like MRIs, are not routinely recommended unless there is a specific symptom or risk factor. Which means he didn't need an MRI unless there was already an extensive problem that they needed specific imaging for. And an MRI is very specific. I had an MRI before they had to take out my spleen. MRIs give you a really detailed 3D picture of what's going on in there. They don't do it for shits and giggles. And he originally went to Walter Reed for his annual physical exam in April. Then he went back 6 months later in October. That is not routine. Yet Caroline Leavitt just got up there and lied again and said he got advanced imaging as part of a routine physical exam and he's in exceptional physical health. As healthy as a diabetic horse. Psst. The bottom line is this man is dying. He had advanced imaging done on parts of his body and he's afraid to tell you what part it is. Which means the Grim Reaper is not only leaving him voicemails, but Trump's afraid to tell you how many.
Caroline Leavitt has just admitted why Donald Trump went and got that MRI. It's a lot worse than we thought.
Would release the results of his MRI Is that happening right now?
It is happening right now. As part of, and this is a summary from the president's physician, and we will release it right now. I think my team has it teed up for all of you. I'll read it for you, and then you'll get it physically as well. As part of President Trump's comprehensive executive physical, advanced imaging was performed because men in his age group benefit from a thorough evaluation of cardiovascular and abdominal health. The purpose of this imaging is preventative, to identify any issues early, confirm overall health, and ensure the president maintains long-term vitality and function. President Trump's cardiovascular imaging was perfectly normal. No evidence of arterial narrowing impairing blood flow or abnormalities in the heart or major vessels. The heart chambers are normal in size, the vessel walls appear smooth and healthy, and there are no signs of inflammation or clotting. Overall, his cardiovascular system shows excellent health. His abdominal imaging is also perfectly normal. All major organs appear very healthy and well perfused. Everything evaluated is functioning within normal limits with no acute or chronic concerns. In summary, this level of detailed assessment is standard for an executive physical at President Trump's age and confirms that he remains in excellent overall health. Again, we will provide that to you. I think that's quite a bit of detail, and in the effort of transparency, the president promised it last night, and we have delivered today. So there you go. Danny.
So he went in because chest pain and abdominal pain. Wow. Now, we obviously don't believe anything Caroline is saying. His heart and everything is perfectly healthy as he continues to scarf down all that McDonald's. So, ladies and gentlemen, brace yourselves because things are about to get real interesting. Donald Trump's health is not in good condition, and you can tell. And I could probably imagine what made it such an emergency. He was probably definitely complaining about pain in that area, and so they had to go check it out. So be on the lookout of more lies coming out from the Trump administration about Donald Trump's health, because none of us believe what they say. And yeah, Caroline, go ahead and publish the results of that MRI so that we can do a thorough check of what's really going on.
My name is Dr. Rubin. I'm going to explain to you a little bit about what an MRI is, what it's good for, and what it's not so good for. So MRI stands for magnetic resonance imaging. You use very powerful magnets to get a three-dimensional picture of the body. It does not have ionizing radiation like you would get with an X-ray or computed tomography or a CT or CAT scan as they call it. And it takes a while to get those images, and it can be quite expensive to obtain it. But when you get these images, it can be really helpful for soft tissues like in the brain, spinal cord, in the heart, looking at various organs, and the joints, looking at ligaments and tendons. It is also a good technique to look at cardiac function in terms of the different chambers of the heart and potentially for inflammation that's going on. You could find specific tumors using an MRI. What it's not so great at doing is looking for things like plaque in your arteries or small vessel changes. You could see the major vessels very well, but the smaller ones, it's not necessarily as good. And if you're looking for early heart disease, you may not necessarily pick it up on an MRI. And so oftentimes you may need to look at a CT angiogram as an example, where you are injecting a dye into a blood vessel with ionizing radiation to see if there's any potential blockages, which is why you may need a CT scan. If you're in an emergent situation where there is trauma involved, a CT scan is much faster to get in an emergent situation and is often quite useful for a stroke protocol, as an example. So there's pluses and minuses to using an MRI versus a CT, and it's important to understand the differences so that you know when you are going to a doctor why they may end up ordering one test versus the other.
I'm a board-certified internal medicine physician, and I'm here to tell you that MRIs are not part of routine physical exams, as the president is suggesting. We do not do them every year or every 2 years as part of your routine physical. If we're going to get an MRI, it's because there's a specific reason that we want to investigate something a little bit more, and it's usually because we found something abnormal on prior imaging like a CAT scan or an ultrasound, or there's abnormal lab work or an abnormal physical exam for which an MRI would be indicated. We don't just do it willy-nilly as part of your physical exam. And if I'm ordering an MRI for one of my patients, I explain to them what the MRI is for. I tell them what the MRI is going to be scanning, so they know when they go to get the MRI that they're going to get an MRI of their brain, or an MRI of their knee, or an MRI of their liver, or whatever, and I'm going to explain the rationale behind that. I'm not going to just make it a mystery to them, like, ooh, we're going to scan some random part of your body, but we're not going to tell you. So maybe the president was really busy, he wasn't listening to the doctor, or maybe he just forgot what the MRI was for. But we do tell you what the MRI is for, so it's odd that he doesn't know what part of his body was scanned and why. And when we give you the MRI results, we're really not that hyperbolic to tell you that it's the best MRI that we've ever seen in the entire world. We just give you the facts of what we found. Now, listen, there is this trend among celebrities like Kim Kardashian and the ultra wealthy who get like these full body MRIs where they just get everything scanned as part of like screening to make sure that they don't have like an occult malignancy, a hidden cancer somewhere. That's not standard practice. It's not recommended by any guidelines because oftentimes when you do that, you find something incidental that requires further workup, more testing, which costs the patient money, and it can subject them to unnecessary procedures. But I find it a little unbelievable that if President Trump had a full body MRI scan, that it was perfect without anything on it, because there have been studies that have shown that if people get full body MRIs, the older they are, the more likely you are to find something. And people over the age of 50 have a 98% chance of finding something. So it'd be very odd that Trump, a nearly 80-year-old man, had a perfect MRI. But I guess we just have to take his word for it, yeah.
These new photos of Donald Trump that were taken today at Mar-a-Lago are raising a lot of questions about his health that we cannot ignore. As you can see here, he looks extremely unwell. He's been consistently falling asleep during public appearances. Here's a better look at him, and as you can tell, there's clearly something wrong. He's been behaving erratically lately, even by his own standards, and of course, we still have no explanation as to why he got so many MRIs recently. When you connect the dots with his family history and what his own relatives have publicly said, the picture becomes even more unsettling. In case you didn't know, Donald Trump's father actually had dementia, meaning it runs in his family, so it's reasonable and responsible for the public to start asking questions when Donald Trump is seen looking the way he does. Even some of Trump's own relatives have spoke publicly about this, including Mary Trump and Fred Trump III. They've said they are very worried Trump has dementia because he's showing the exact same signs they saw in his father, such as erratic behavior, repeated stories, obsession with wealth, public outbursts. These aren't partisan attacks. These are people who saw his father's condition firsthand and are noticing parallels. Regardless of your political beliefs or how much you love Donald Trump, you have to admit, this is not a good look. The White House is trying to claim that the 4 MRIs Trump has gotten this year alone were all preventative. That's of course not normal for somebody who's perfectly healthy, as they're trying to claim, but let's take a look at this memo. It claims that Donald Trump's cardiovascular and abdominal imaging is perfectly normal with no evidence of any issues. And if you'll notice in the very short summary, they claim that getting 4 MRIs in 1 year is just totally normal, no big deal at all, and that Donald Trump is in excellent overall health. They're absolutely right. This guy is in the prime of his life. There's clearly nothing wrong with him. He could run a marathon if he wanted to. But seriously, everybody should know that 4 MRIs in 1 year is not routine. That isn't how preventative care works. Not for the average person, and definitely not for the president. Routine preventative imaging is usually done once a year, if at all, unless of course doctors are actively monitoring a concern. The fact they keep giving Trump MRIs over and over again suggests they're watching something closely. And the memo itself is incredibly vague. That was all of it that I showed you. It's not even half of a page. It loads up on reassuring adjectives like perfectly normal, excellent health, smooth and healthy, but it never gives us a logical reason as to why he had 4 MRIs, because preventative care is not one. But I'd like to point out that patients taking this Alzheimer's medication are required to have MRI scans. In fact, they need multiple different ones in their first year for safety monitoring, including a baseline MRI and then several pre-infusion MRIs. Keep in mind, Donald Trump's father passed away from dementia, so it does run in his family. But one thing is clear, these 4 MRIs were not all preventative MRIs. They are clearly watching something.
Let's talk about Trump's MRI results. Hi, I'm Internal Med Doc. I've taken care of a lot of seniors in my life, read a lot of MRI reports, and something is fishy. Things are not adding up, and here's why. As part of his executive physical, President Trump had a bunch of MRIs done. Here's what's unusual about all this. First of all the reports are talking about an MRI of the abdomen and his heart. In the context of why this is all being asked, those test results are kind of useless. He is the President of the United States. Everyone is questioning his decision-making ability, his cognitive abilities. What people want to know is, what does this MRI of the brain look like? There is no mention of that. As I've said before, I've taken care of a lot of seniors who've had MRI of the brain for a variety of different reasons, and they are never 100% normal. MRIs show a lot of details of what's happening inside our body. Radiologists are really great at pointing out every little detail that they see, every little anomaly, even if they are not clinically significant. And I guarantee any 78, 79-year-old person, There are significant abnormalities in the brain, microvascular disease, who knows what else. Maybe signs of cerebral atrophy, a little bit of shrinkage. The second red flag is the narrative that they are publishing about those MRI test results. They are not how radiology reports are written at all. Those narratives that Caroline Levitt read at the podium today are not an actual radiology report. They are simply a narrative written up by someone who read the radiology reports. In other words, they cherry-picked the details from those MRI reports that they wanted to create a summary about, and that's what they published, not the actual radiology results. And the last red flag about all this is the president's personal physician, Dr. Sean Barbella. He's the one producing this narrative that everybody's reading, and here's what's wrong. This is no disrespect to Dr. Sean Barbella, who looks like a genuine war hero when you read his biography, but he is an emergency medicine and tactical medicine expert, which means war field, battlefield medicine. He is not a geriatrician. He is not an internist. He's not a family medicine physician. He's someone that specializes in limbs and arms being blown off in the battlefield. He is not someone who takes care of someone with chronic disease, doesn't deal with people with chronic disease like dementia, memory issues, cardiovascular disease, you name it. This is not the right type of physician to be looking at a patient like Donald Trump and writing up a narrative. So in summary, no MRI of the brain, a cherry-picked narrative written up by a physician who is not an expert at these types of situations and patients, and unable to answer the question everybody wants to know, is the president cognitively competent and healthy to perform his job?
So Trump has reportedly had 4 MRIs this year, 4. And he keeps insisting that they're just routine checkups. But here's the thing, right? Doctors across the country are now stepping forward saying that nobody gets 4 MRIs in 1 year unless something is seriously wrong, right? And, that is not routine, and that's not even suspicious. It's concerning. And when, the journalists asked him what parts of his body they needed to check, Trump said he didn't know. How do you not know why you're getting an MRI, right? An MRI is not like checking your blood pressure. It's specific. It's targeted, and there's a reason. There's always a reason, but he keeps doing what he always does, deflecting. He said he took a cognitive test and he aced it. And after the MRI, the doctors told him that it was the best MRI they had ever done. Like, what does that even mean, right? How do you ace an MRI? Is it a school exam now, right? Like, this is why so many people think that he's not mentally fit for another term. The inconsistencies, the rambling, the evasiveness, it's giving something is wrong and they're hiding it, right? And the part that really upset people was the way he spoke to the female journalists. They asked completely normal medical questions and he snapped back, saying that they wouldn't be smart enough to ace the cognitive test like he did. He always talks down to women, especially when he's cornered, and it shows, right? So 4 MRIs in 1 year. Doctors are calling that a red flag, not a routine. Something is definitely going on behind the scenes, and the public obviously has, the right to question it, especially when the man asking to run the country can't even explain why he's been inside an MRI machine 4 separate times, right? But let me know what you guys think in the comments, because the more we hear, the weirder it gets. But thank you so much for tapping in when you saw this video. Don't forget to like, share, and subscribe to hear more stories, more information that you don't get to see on the news. And as usual, I'll see you on my next one.